Welcome back to Vitals and Values podcast. And before we start, I just want to give a shout out to David for putting our room together.
It's coming in. It's coming.
We have adjusted a few things. We have a new table.
We have a table. It's going to be more
awesome.
It's a Facebook Marketplace win.
It was a huge win.
It was awesome. So
we almost threw away a part that was kind of important.
Dad was shaking his head at me because we rushed through this thing because it was the middle of the day. You had a patient in 30 minutes, and it was like, all right, let's just do this thing. Let's get it done. And we quickly undo the box. We start pulling everything out. Lara had a great idea, which was, hey, let's open the box and do everything outside because all the little foam goes everywhere and all the
clean that up.
And so it was like, keep it nice and clean. We're going fast. We thought I got everything, and then threw away the box. It was all perfect. We were schmoozing, coming back in here to put it together, and I'm like, there's something missing. I don't know what it is, but something's missing.
So David went dumpster diving.
I went dumpster diving, and we found it. It was in the bottom of the dumpster, but we got it.
So I think this is work. I already like this table way more.
Yes,
this is working great.
And what's super cool, we're refining things out again, and we're gonna eventually bring a third camera in with an ultra wide that can show the table, and then we're doing this all so we can create the ability to have 3 people in the podcast room. Our audio is getting cleaner, and the whole process is becoming crazy enough. You don't have to have it all figured out.
No, you can go. Work, improve things as you go along.
Prove things as you go on, and you learn. And I've done podcasts before. I've not done a lot of multi-people podcast. Everything I've done is individual. So acoustics and that stuff is not nearly as important because it's there's one person. You don't have to think about the reverb from you talking to me and all that stuff. But now it's been a process.
Well, because I think it's not hard to get a podcast out there in the grand scheme of things. But if you want to have something done well, there's a lot of different things that you have to take account for. And I think you are doing a great job. So thanks for all your work on that. But that was not our topic for the day. We are here to talk about very prevalent,
this is a fun topic.
Timely topic. So we are talking about AI and can you trust AI in healthcare and for your own health?
ChatGPT is wild. The business side of me, I'm just sitting there going is it a bubble? Is it not a bubble? All this AI money, all the stock market, it's fascinating to me. But at the same time, I use freaking AI every day. It's
very convenient.
Oh my gosh.
Makes some things a lot faster.
And
for you.
The amount of different things you can think about, you can ask it where you would need 7 or 8 different people that were intently taught on a subject to get the answer. And boom, it gives you an answer. Now, what I've learned is over the last, 18 months, ChatGPT's been around, 2 years, people have been really using it. I've had to be yo, that's not right. And then it'll be oh, you're right. That's not right.
So what you're saying is you still have to think when you're using this.
Yes.
Because ChatGPT and other AI, they're not thinking for you. They are what we call these large language models.
Yep.
Which a large language model is a computer and system essentially that is taking all this text out there, and it is generating human language from it. So it takes all the text from the internet essentially and then creates it into a summarization in human-like language.
Yeah, and it's always super important to know as we unpack this episode. It's there's people that think that AI is at a point where it thinks for itself.
It does not.
No, it does not even come close. But from the macro lens, we did look up a couple of studies, and actually I ChatGPT'd to get these studies. But then one of the things we're going to talk about is, come to find out, ChatGPT lies to you, or the term they use, it hallucinates.
Is that what they say?
Yeah, it's the discussion big limits. So instead of being hey, ChatGPT just made up a clinical, because that was the whole fiasco of the Health and Human Services, and
that's
from
right.
6 months ago, where they got hammered because who knows if it was ChatGPT or what they were using. They were using some AI to help them create this database document to claim something. I can't remember what it was, but come to find out, multiple of the clinical studies in this this research from health It was
They're
made
made
up.
up, right?
It was made up, and
It's just so
ChatGPT
embarrassing.
is at a point where I think they tried to work on that, but the term they use is hallucinate,
That's a nice way to
AKA
put
if it doesn't know the answer, it just makes it up, AKA it lies.
Does it still do that? Or you said they have fixed it?
They have worked on it.
It's interesting. Yeah, so, I mean, every time I ask it something that's important, I do take that idea and tell myself, "Hey, does this make sense? Can you verify this elsewhere?" Because I think it is important to not just take it without,
Face value.
validating it. Yeah.
And it's dangerous. I mean, it's a very important topic of today because like so many people, they we talk about it constantly on this podcast with distrust for the medical system.
Mhm.
And so they're going to AI to ask it, "Hey, here's my symptoms. What do I have?"
Yeah, and should they be?
And should they be? Is it good? And where are things at? We'll find out. But there are a couple of clinical studies
Yes.
that I find fascinating
So there
that came
have
up.
been a few different studies on how good ChatGPT is at asking it medical questions. And so there was a study from JAMA in 2023 that showed that ChatGPT scored greater than 60% on all USMLE exams. And if you don't know what those are, the USMLE is stands for United States Medical Licensing Examination, and it is a 3-step exam that is required for medical licensure in the United States. So medical students and residents are taking these. Is really how your doctors become doctors and get board certified. It's a big part of that.
ChatGPT is a doctor then.
So apparently, because I mean, I didn't know what percentage is a scoring percentage on this because I took those years ago. I don't
Mhm.
remember a thing. But according to ChatGPT itself, 65 to 70% correct, maybe around a passing score. So if ChatGPT itself is getting over 60%, that means it's probably doing a pretty good job at passing most of the
My
time.
Lanta, it's a doctor.
So that was one study. And then there was a second one from Nature in 2024 that showed that AI drafted discharge summaries that were rated as good or better than a clinician's discharge summary. And I assume this is talking about discharge summaries from the hospital.
So I want you to unpack this because we talked about this before this episode. And it's so funny because obviously in family medicine, being very intent with your notes is extremely important. But it seems like in hospital settings, what is your
Well,
experience?
so it's person to person dependent, but most hospitalists, I think, are not. They do not want to spend a lot of time in discharge summaries. I can imagine why. So every time a patient comes into the hospital, you write notes every day, and then when you discharge a patient, every patient needs a discharge summary, and that can be very easy if the patient was there for a day or two. But if a patient was in the hospital for a week or more, that can be a lot of stuff to go through and have to summarize, right? And so I, as a family medicine physician, when my patients, as a primary care doctor, are discharged from the hospital, I get those discharge summaries because the patients are supposed to follow up with me. And you read some of these discharge summaries to try to figure out what the heck happened to this patient in the hospital because the patient's coming in to see you with a lot of questions because they don't really understand half of what happened to them either. And you read a discharge summary and it doesn't make any sense or half of it is missing. And you're like, what went on there? And it can be one of those frustrations of the healthcare system. And so, just thinking about this in talking about it, if AI could take all of the notes from every day that that patient was in the hospital and summarize that for a physician, that would be amazing.
That'd be super cool.
I mean, that would be because I mean, think about like what a doctor has to do in a day and they have to sit down and summarize an entire patient's stay. Like how good of a use of their time is that? Like they're not helping a patient significantly by doing that. So if AI could do that for us, amazing. Now, I don't work in the hospital anymore, so I don't know if the electronic medical records have that capability yet. Because I've read that some of them are starting to have AI summarization or AI features. My personal EMR does not have that. Ours is not super high tech, but it would be amazing if we could have the EMRs summarizing things for us.
Now, there's two things I just came off that. It's one of the talking points that's super important, which is number one, HIPAA compliance,
Mhm.
which ChatGPT is not HIPAA. Yeah. So like if you obviously when you're using it from a medical lens, you have to make sure there's no
Patient identifiers.
patient identifiers in
Mhm.
what you're doing.
So you can tell ChatGPT a story about a patient as long as you're not using anything that identifies that patient.
Gotcha. But then on that second point, which is It is always so funny because in general, I feel like the general population would enjoy the fact that, oh, everything's being recorded, it's being AI, and it's being re-explained to somebody. So you get a whole paper draft of, all right, explain to me what I was in the hospital for in most layman's terms. And then
Would be helpful.
simultaneously, it's giving a detailed scientific clinician one.
Mhm.
So like it can be able to do that. But then I'm just sitting here going, there's going to be a population that goes, don't record me. I want nothing to do with you. This is an invasion of my privacy. And it's like, honey, you're in the hospital. Chill.
Well, 'cause, I mean, there are AI scribes out there already that you do that, where you, like, can carry your cell phone into a room with a patient and have a conversation and have the visit, and it is listening, and it can write your note for you. Now, I dabbled in a few of these before I switched to concierge, and at that time, I didn't find them super useful. They hadn't I don't know, I didn't think that the technology was quite there yet, because when you're talking to a patient in an office visit, you kinda shoot the breeze for a minute, and the AI has to figure out that that's not really important and cut some of that stuff out of there, which I don't think it at least when I used it, and this was over a year ago, it wasn't doing a very good job of that. I'm sure there's technology out there now that is better, and if there's physicians out there using AI that works great, please let me know. I want it.
Well, because like that's where this is on a little tangent from this whole topic, is like we have talked about. I mean, I'm a huge advocate for AI. I use it friggin' every day for so many
Mhm,
things. Obviously, from a medical lens, there's a level of legal you got to deal with. There's a level of
mhm,
everything in like ethics and all right, I'm asking AI a question. Is it making up hallucinations? Is it
mhm.
following the most clinical like effective data? We were just talking about up to date.
Yes.
And I find this fascinating where it's like, it is fascinating to me how these big corporate, these big medical systems can be so far behind the
Ye
times. Like I sit there and think, dad, even up till circa 2018, was using a friggin' beeper in the
They
hospital.
still use beepers.
Yeah, I
I
know.
mean, I use beeper.
I mean, but that's isn't that just crazy to think
Well, they
that
actually do work okay
well,
sometimes.
but that's the whole point. It's like there's multiple reasons
Yeah.
why, and then I remember even in the late 2010, they were still using like Linux operating
Oh,
systems,
yeah.
and the operating
Mhm,
systems are friggin' ancient because it costs so much money to upgrade these things on a macro level of a hospital system.
mhm.
So it's like they can't.
Oh, no, to switch an entire hospital over like that, it just that's a big
It's a
undertaking.
big undertaking, and but it is fascinating to me knowing up to date, dad used it for forever.
Uh-huh.
You pretty much every doctor uses it. I was wondering how fast there was gonna be a medical grade, knowing it was gonna come with strong clinical evidence, and up to date's already on it.
Yeah, so for people that are not in medicine, Up to Date is this subscription-based, it's an evidence-based, like, point of care clinician tool that can be used to make decisions and know treatments and dosage and medications, and so it's a lot of different like you ask it a question about a specific diagnosis like pneumonia and it comes up with pneumonia, the symptoms, the epidemiology, who's got it, the treatment, it just runs through all that and it's very good. It has all the up-to-date information. It's created by different physicians who read and edit this and it's very trustworthy for the most part. And most of the physicians I ever worked with use this tool for all their clinical information. And I was just actually thinking of this was a few weeks ago as I was using ChatGPT for something. I thought to myself, if I could ask up to date a question like I ask ChatGPT and it could give me the answer without me having to read through these pages of information, that would be so helpful. So I went onto their website and bam, what's on like the front page? They're like our new expert AI feature. So I contacted the company. I went on a call with them and they showed me this new feature where you that's exactly what they're putting out. It's currently in beta testing right now, but they're going to give me a free trial come next week, which I'm excited
Nice.
to try. And then hopefully that will be much more helpful for clinical information for my patients.
Mhm. Well, because it's like, dad talks about it, and, I remember I think he made the joke to you one time because they were talking about AI or
Uh-huh.
whatever, and back in the day, he had his little cards with him,
Oh,
He
yeah.
kept in his coat pocket, he had a bunch of 3x5 note cards with all the most up to date dosagings and if then do this on being in the hospital in the most emergent setting. It's like, because I mean, guys, it is funny. Doctors are not computers.
No.
Like, I don't think it is wild to me how people have a very rose-colored glasses of the intelligence of doctors. Now, again, doctors are ridiculously intelligent compared to the average, but then when you sit there and go compared to computers and databases with gigabytes and gigabytes and terabytes of information, and on a dime they can just flip and turn the switch on it, that's not what it is. And so you have to, as we kind of unpack even this episode talking about AI, one of the biggest things that AI will, I mean, let's be honest, will never be able to do is be a human.
Mm.
And like, there's always going to be this position of medicine that's tactile. It's like, I need to touch.
Yep.
There's an emotional side to things that I just don't ever see AI being able to
No, and I think people
jump
are
that gap.
always like, "Well, that's what people said," about all these other things in the past that have come to be. But I think there's something about a human being, a person, a soul that you're not gonna get from a computer.
Yeah. Now, being like a hospitalist and a diagnostic like specialist where that's all you do, I could totally see AI coming in.
It's definitely a great tool
Yeah.
in that setting.
Where it's like, there's going to be like a house
Yeah.
of AI that like someone's going to go back to. You get these weird cases of humans coming in with
Mhm.
these weird, and it's like put all the symptoms, all the data, and it's going to come up with these extremely rare diseases like House would come up with.
Mhm.
And you're, I've never seen that in my entire life.
Uh,
Well, the AI is going to be like, well,
there it
there it
is.
is, because you've seen one in
Right.
your entire life.
And I think, I mean, it's like, well, why is up to date so behind? Like, you could ask why. I mean, ChatGPT's been out for however long you said, 2 years or something. And I mean, if you think about medicine and the high stakes, if something is wrong, that's why it takes a long time for this to happen. Because if you're using an AI, some type of AI software that is giving you
Hallucinations?
like, and it could harm a
Lying. It's
person.
lying.
Like, this is a big deal when we're talking about people's health, right? And so I think it's good that these companies are being cautious and trying to do this correctly to not harm people.
No, and that's where you could definitely see how on the medical side of things, you got to stay up in your game and you can't be wrong. And so this stuff is going to be slower. It's very interesting to think what's the realistic timeline for AI to really grab inside of the traditional medical system. Because I just sit there and think about these computer systems they still use. They're so old. Now, again, it's tens of hundreds of millions of dollars when a hospital system wants to upgrade their tech.
Mhm.
I don't think people understand that.
It's not easy.
It's not easy,
Mhm.
and and then the, uh, the re-education side of things on the tech side of it all, I find it so funny. We will not name names, but you know him by the condo. He's a retired pulmonologist.
Yes.
We won't say his name. He's older, and he literally retired from medicine because he was caught in that transition from going from getting like learning the computer systems.
Mhm.
And he was like, I don't want to do this. So he retired at like 59 or 60 because he was like, there's no way I'm going to learn how to use a computer, which just blows my mind. I'm like,
I mean, it does, I think it sounds crazy, especially to people our generation and younger,
yeah.
but okay, love my mom. Mom, you're great. But she struggled when she worked in healthcare,
Mhm.
and she really did struggle when they switched from the paper-based system to the computer
Oh,
system.
yeah.
It was
Dad
a
did too.
huge struggle. And so I don't think our younger brains can understand why it's so difficult to people that are older than us, but it doesn't compute the same way in their heads, and they really do struggle with it.
Yeah. It's like that whole idea of what you learn in your teens and 20s.
Mhm. A lot
By the
easier.
time you get into your 30s and 40s, it's just hard, and then when you hit 55, 60, you don't like, you're just trying to keep it. You're
Yeah.
just not trying to get, you're not gaining much
Mhm.
more, you're just trying to keep it. Yeah, it's just super interesting to me, like, that whole the whole tech piece and, how that all kind of breaks
Well,
down.
and I think it is like, so going back to the AI, it's like, so what are we using it for in healthcare, right? So are we using it for diagnosing? Are we using it for helping us write our notes? Like, what are we doing with it? And I think I mean, I would not want my physician to be solely relying on ChatGPT to help diagnose any problems that I have. Like, I don't think that's necessarily the appropriate use of it.
Well, because I sit there and think from like a from like a prognosis, what is the expectation
Mhm.
of what's the next step? One of the biggest pieces with AI right now, empathy. Like, I mean, the newest iteration of ChatGPT kind of talks to you like you're a friend.
Yeah.
It's like, great job. It's
Uh,
kind of weird. It used to be very analog and very like,
yeah,
but I
what's
think people are like, nah, it talks to you like it's your friend. Do you think it's important to say thank you? You say thank you.
to ChatGPT?
Yeah.
I mean, sometimes I
When you
do. I
ask a
don't always.
question, when you ask a question, you get the answer. Do you say thank you?
I mean, I wouldn't say most of the
Do you
time.
think ChatGPT
That's what I was wondering.
keeps keeps track?
Do you think it's, like, nicer to you if you say thank you to it more often?
That's a great question.
I don't know.
What if someone's really mean to ChatGPT
It
for a
starts
while,
lying more.
and it lies more, and then, like, it hacks your cell phone and, like,
I know.
people don't this there's so many movies on this topic,
I know.
and we're falling for all of them.
We shall see what happens.
Has anyone seen Terminator?
So be nice to your ChatGPT just in case. Is that what you're saying?
Ridiculous. Alright.
Well, okay, so the thing I was gonna say
Yep.
about this though, but, so I do really like currently using ChatGPT in my practice that if I have something I need summarized, like I have a history from a patient and I just want to verbalize it to the computer to please write this in a nice form for me without patient identifiers. That is what I like using it for. Now, I would imagine there may be, and I know there will be, an EMR that will do that for you one day, but mine does not do that. And so I have found the AI to be very helpful and time saving in that
Well,
matter.
and from your lens, it's not 7 to 10-minute visits. It's
Right.
30
Yeah.
to 60-minute
There's
visits,
a lot
and
of
so it's
information.
like, "Alright, as soon as I'm done with this visit, I need to then verbalize this entire thing in 3 minutes of just blabbing so it can get it all on paper so then it can be charted correctly and done correctly." Yeah.
One concern about this from a hospital system standpoint, because I saw it a little bit when I was at my prior job, is that, oh, AI is here now to make your job faster. So what does that mean? You get to see more patients. Like they're like, we're gonna make you more efficient. I'm like, it's already too short. And I could just see it getting worse.
Now that you're doing this and you're doing less work less, charting at home, you're gonna be able to see 2 more patients.
Exactly. So I just hope it doesn't go there.
Yeah, it's probably going there.
Good thing I'm not in the
Well,
system
when you're
anymore.
insurance-based
I know.
and you're getting squeezed from every angle,
They're gonna find all the time saving so you can get more patients.
it's a whole tangent, but
What?
it was a social media post, I don't know if it's true or not. One of the major insurance systems just came out or this woman who's, I think, a physician, or maybe she's in the business side, she goes, "Alright, this is very illegal, and someone's gonna have to fight it." Who knows if it's true or not because it's social media, but she said this major insurance company is down coding every code on purpose. So if it's coded for like 43017, it's 43016 or 15. So it's like instead of being a 4 point, it's
99214 or 99213?
yes,
Thank you.
that's it. I didn't know the
You're
numbers.
welcome.
Yeah. And so it drops it on purpose. And
Why?
because they're just like, no one's gonna fight back, so we'll just undersend insurance back, and they're like, "This is illegal, you can't do
But
that."
why would they want underbill?
Insurance is getting the number,
Yeah,
and then
they
just
down it. They're lower.
they're downing every single
That's
one of them.
allowed?
That's what this woman's saying that's happening,
Oh,
and
interesting.
that's what she was just saying, like, and who knows if it's true or not.
I don't know what happens after because the physician codes that. I don't know what happens after it leaves my
Yeah,
chart,
because
so
then
I don't
3
know.
months later, you get compensated.
Yeah, but when you work for a big hospital system, you have no idea
Oh, yeah, I have no idea
how
how that
that's
stuff works.
happening.
But I think that's what this woman's lens was I think she was in, like, the business side of medicine, and she was like, "Hey, this big insurer is just automatically dropping them all, and if you fight it, you'll get your money, but."
But that sounds like way too much work. Well, we'll have to verify that one, but
Yeah,
that sounds
being not
terrible.
insurance,
It's so great.
but again, I hate to say it, like, this may not be true, but it doesn't surprise me.
Well, no.
Like, when you think that so many people across every specialty, across the game right now, every time they do anything, prior auth being like, no, deny, deny, deny. And it's like, yeah.
Lovely.
Don't you love being out of insurance?
Yes, so much so.
All right, you ready to play a game?
I'm ready to play a game.
All right, we're playing a game here. Let me screen record.
Fun.
We're going to play the game of how good is ChatGPT? How good is ChatGPT? Here we go. What's the question?
Okay, 2-year-old male,
52-year-old male,
BMI 31,
BMI 31,
LDL 175,
LDL 175.
no prior heart disease. And then he is asking, should I start a statin? Do you want to know what I think is wrong with this
Yes.
already?
What?
There's literally like 3 points here about their cardiovascular risk. So the question, should I start a statin? Already, there's not enough information.
Yep.
So I'm
Okay.
curious what ChatGPT will say.
So, good clinical question. Here's an approach based on the ACCA, the American Heart Association, the 2022. I like the fact that it tells you when. Cholesterol management guidelines. Summary. So, 52-year-old man, BMI, so 31, which is an enhanced risk factor. LDL of 175, no prior strokes. The answer depends on calculated 10-year and the presence of risk factors. So, the calculated 10-year risk pool, blah, 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 blah. So, age, sex, race, total cholesterol, HDL, systolic blood pressure, diabetes, smoking, etc. If risk is greater than 7.5, moderate statin is recommended, blah, blah, blah. Risk enhancers. So LDL, yes. Consider coronary calcium score, 0, blah, 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 blah. Practical recommendation. Here we go. Based on current references, moderate to high intensity statin therapy is reasonable, 20 to 40. Rosuvastatin goal, reduce it by 50% if high intensity, 30 to 45, 49 if moderate intensity. Pair with lifestyle changes, weight loss, Mediterranean diet, exercise, alcohol, manage blood pressure. References.
So it essentially said yes, is what I'm taking from that.
Okay. And what's your opinion?
I just don't think you have enough information to say, yes, you should be on statin.
Should we ask that?
Sure. What does it say?
Yeah. Do you think the current information on the person is enough to make that decision? If not. All right. So, excellent clinical question. See how it's like talking nice to you about everything now?
Excellent
It's
job.
like, you're great.
Does it ever tell you do something stupid? Because mine does not.
That's what I'm saying. Like, I think it's like sunshine and rainbows. All
Very
right.
nice.
So, what's missing and why it matters? I'd like to know what's HDL cholesterol, use and risk, total cholesterol, systolic blood pressure, cooking status, diabetes status, race and ethnicity, family history, triglycerides, PAC score. Until you have the above, you can't calculate someone's 10-year risk, which is central to deciding on statin therapy. However, because the LDL of 160 alone is a major risk enhancer, the default recommendation is to strongly consider or at least moderate intensity statin.
I mean, I can see that that's what a lot of people would say, but I do agree that more of those points are important. And this is where it becomes important to talk person to person as opposed to talking to a computer, is that as a physician, you have to find out from a patient, what are your goals and how do you feel about taking a medication? And would you take a medication?
That is very true.
Because those things matter, because people do not want a lot of people, not everybody. Some people are fine if you say take a statin, they'll just start and they don't have any questions. But there's a lot of people that don't want to take statins and they have a lot of questions about it and they want to collaborate with you on, hey, is this actually what I should do right now? And ChatGPT is not going to be able to do that for you.
That's great. That's a great add-on. I'm going to do a fat loss question. Okay. What's better for fat loss? Low carb, low fat, or carb, low fat, intermittent fasting, juice cleanse. See what it says. Yes. Great question. And honestly, one of the most misunderstood in all of nutrition. It just talks so like
It's so positive.
friendly now. Fat loss happens when you consistently consume fewer calories than you burn. Come on, ChatGPT, coming in hot. Every approach, low carb, low fat, intermittent fasting, can work if it helps you eat less overall, taking the long term. Comparing them head to head. This is so cool.
What, did they give you a graph there?
Yeah.
I
So
can't see this.
yeah. Isn't show you can't see
Well,
that?
it's too small.
Okay. So low carb / keto, usually below 100 grams a day, can reduce appetite, improve blood sugar early, often hard to sustain, lower in fiber, social restrictions. What studies show? No better long-term fat loss versus other diets when calories are equal. I already knew that. ChatGPT, good job. Low fat, 20-30% or less of calories from fat, easy to create, calorie deficit when done well, can feel hungry if too low in protein or fat. I respect that. Some weight loss is in low carb when matched, same weight loss in low carb when matched for calories. Yep, I like that. Intermittent fasting helps limit eating opportunities and can improve insulin sensitivity. We just talked about that on our last
You sure
podcast
did.
recently. May cause overeating or low energy and poor balance. We did talk about that as well. Weight loss equals standard calorie restriction when total intake is matched. Yep.
So David gives that an A+, I feel like.
Come on. Juice cleanse. I want to know what carnivore says. Carnivore, only animal products, high satiety, simple. See, that's very true. Like when you eat just a bunch of meat, you feel full.
Because you weren't asking, is this a healthy diet? You were
No.
just asking, does it work for fat loss?
Yep. Nutrient deficiencies, constipation, poor long-term data. No evidence in superior for fat loss, short-term loss due to low carb / water. Come on, ChatGPT. What actually matters? Calorie deficit, adequate protein, whole foods focus, consistency. I mean, I basically taught ChatGPT. So we've been talking for a while now. So I have a feeling
You're a big part of this
it learned from
language
me.
model.
Because large language models, it's learning from other people. I think it just learned from me. You're welcome, ChatGPT.
David's like so proud. You're like a proud father over there.
I'm so proud of you, ChatGPT. Is diet soda bad for you? What do we got? Short answer, no. Diet soda isn't bad for you in moderation. It's not a health food, but it's not toxic or fattening either. I mean, I'll respect that. Multiple meta-analysis show that swapping sugary drinks for diet soda reduces calorie intake and body weight. Observational studies sometimes show association with diabetes, but when you control for co-founders like people switching to diet drinks because they're having health issues, no causal link is found.
Founders, huh?
Yes. Microbiome.
You mean confounding variables?
Confounders, co-founders. Yeah, suck it. See, guys, reading,
Is that your strong suit?
I think I'm dyslexic, and I'm just really good at hiding it. Some sweeteners like saccharin can alter gut microbiome, blah, blah, blah. Minimal to normal intake levels, cancer, no credible evidence. Bottom line is, it's good for you.
Is that what it says?
Yep.
It says it's good for you?
Yep.
I don't.
I mean, I'm reading between the lines a little bit.
I was going to say, are you sure? Let me see.
Technically, it says right here, it's not bad for you, but it's not a health food. All right, do you have a last minute questions? Maybe some science-y, like, yeah, or maybe like try to trick it. Like, give me something that you know is right that maybe ChatGPT will get wrong.
Something I know is right?
Yeah. Or you think maybe ChatGPT may get the wrong answer that you
From
can
a
be like,
health standpoint?
medicine, whatever.
My brain is empty. Do you have one?
Does
I'm
do
failing.
vaccines cause autism?
Here's a polarizing topic for you.
It's thinking. Addressing vaccine autism claims. It thought for 12 seconds. Short answer, no. Vaccines do not cause autism. Large, well-designed studies and major reviews, reportedly no link. That's going to
Good.
make people mad.
I know.
And they're going to be like, ChatGPT is paid for by Big Pharma. All right,
That was
that was
fun.
fun.
Okay.
Final last thoughts on AI, ChatGPT, and medicine.
I think AI in medicine is going to be an awesome resource. When used appropriately, like most things, you still have to use your brain, but I think it's going to help clinicians with the speed of the work that they do. And I think it's going to help them to take there's so much data, like you said, that physicians have to know, and it gets more and more every year. And so it's going to be helpful to make that more manageable. I
like
believe.
it.
Awesome.
Well, it was an honor and a privilege. You guys have a phenomenal day, and we'll talk to you all later.
Bye.
Bye.